So in this session, I'm going to talk about a very important anatomical concept you need to keep in your head, which is called heart dominance. Everybody, heart dominance. Everybody.
Heart dominance.
Again.
Heart dominance.
Okay. So heart dominance. Heart dominance. When we say heart dominance, what do we mean? When we pick the general population, someone's heart can be described as a right dominant heart or a left dominant heart, or sometimes, or in a few occasions, or in a few instances, a co-dominant heart. Okay, so these are the various classes. A right dominant heart, a left dominant heart, the circumflex artery is a branch of which artery?
Circumflex artery is a branch of the left coronary.
Thank you.
Artery.
Thank you. It's just one of the ways to just take you on our ways. And I said co-dominant, okay? So cardiac dominance. Now, what do we mean by a right dominant heart? What do we mean by a left dominant heart? I say left-handed guy. You have two hands, but you are left-handed, or you are right-handed, or you are ambidextrous. So you can use both left and right, isn't it? So just like you have lefty, righty, those informal words, your heart can be right dominant or left dominant. And in actual fact, about 80% of the population have, a majority of us have a right dominant heart. What did I say?
The majority of
us have a right dominant heart.
Exactly. So the likelihood that all of us on the panel right now have a right dominant heart is very high. So what do you mean by right dominance? What do you mean by left dominance? Now listen. The dominance, the heart, okay? The dominance of the heart is actually based on cardiac dominance, whether someone's heart is right dominant or left dominant. The dominance of the heart depends on, listen, let me use a white thing here. It's very interesting. The dominance of the heart depends on the answer we get from this question. Which artery, listen, the dominance of the heart depends on which artery gave rise to the PDA. Do you see that?
Does that? Okay.
It means that it's not always that the right coronary artery ends in the PDA. Sometimes it comes from the circumflex artery. Do you see what I'm saying? Hello?
Yes, sir. Yes, sir.
Which artery gave rise to the PDA? So the PDA is actually a very important, so apart from the fact that when it is blocked, you can have an inferior MI. It's a very important artery. So if you want to know your heart's dominance, you just ask yourself, where did my PDA come from? Where did the posterior descending artery come from? If the answer to your question is that it came from the right coronary artery, then your heart is defined as this is described as what? A right dominant heart. Okay?
Yes, sir.
If it came from the left coronary artery, and when I say the left coronary artery, specifically, I'm talking about the circumflex artery, okay? Then your heart is described as what? A left dominant heart. But if both contributed, so but this concept is not so common. It's very rare. Okay, so it's usually right dominant, left dominant, but some books have documented codominant. But I want you to understand that the codominance is not really something you should worry your head about. But it is possible for someone's PDA to be contributed by both the right and the left. However, so please, do you get this concept?
Yes, sir.
Good. So I'm going to show. Let me see if I can get left dominant heart. I don't know if there is something. So yeah, so left dominant heart circulation. Okay, so this guy actually gives us what is happening here. Okay, so hold on, let me pause this video and then I would. So let's see. This is what the right dominant heart. Now, if you check, this is the PDA, right? Can you see the PDA?
Yes.
So if you check this PDH, good. So this PDA actually came from the right. Can you see that? So because of that, this heart is described as what? A right dominant heart. And I'm saying that over 80% or about 80% of us, if you pick 10 people, 8 of them, their PDA actually came from the right coronary artery. And this is the left dominant heart. Do you see that? Look at what happened. The right coronary artery gave rise to its marginal branch. It went like this, but it didn't contribute to the PD. But look at the circumflex artery. It came like this, and the circumflex artery was the one that actually gave rise to the what? The PD. Can you see that?
Yes, sir.
We have anatomical variations like that. Okay, then look at this. The right coronary artery actually goes down like this. The circumflex also goes down like this, and then two of them contribute. Can you see that?
Yes, sir.
So that is co-dominance. So the point here is that we have cardiac dominance, and you should take note of it. You should understand and take note of it. A cardiac dominance is defined by which of the coronary arteries gave rise to the posterior artery descending, posterior descending artery, I wanted to say, or the posterior interventricular artery. Is it the right coronary artery? If that is the case, as is found in most people, most humans, that is a right dominant heart, like how most of us are righties. If it was contributed to by the coronary circulation, the left coronary circulation, specifically the circumflex artery, then you have a left dominant heart. And if it was contributed, okay, by both, then you have a codominant heart. So look at this question. You know that generally, the principle that the inferior surface of the heart is supplied by the right coronary artery, right? By what I just taught you. But if you find this question, look at this question. A consultant cardiologist found that his patient had a left dominant heart? Which of the following statements is true? A, the left ventricle is more robust in this patient. B, the left. Okay, so which of the following? Because I think if I don't modify the question, it will be ambiguous because you know that the left ventricle is more robust, isn't it? So, which of the following statements is true regarding this finding? Then we have narrowed the question, isn't it? A, the left ventricle, the left atrium is more robust than the right. A block in the left coronary artery will result in an inferior MI. D, the inferior wall is supplied by a right coronary artery. Answer. Oh, you are thinking about it. Let me pause it so that.
Yes.
Okay, so everybody type your answer directly to me via Zoom. Decision time. Go.
True.
Where do you type in Zoom?
Type its direct message on Zoom, not on WhatsApp.
Left circumference artery.
So Rebecca, correct? Okay, I don't have to mention your names. So correct. Koju, be careful. Hey, I mentioned your name, but be careful. It can't be. This guy has a left dominant heart. What does it mean? It means the PDA came from what? The left. And since the PDA supplies the inferior wall, do you think that the inferior wall is supplied by the right coronary artery? Kojo?
No, doc.
No. Read your question and understand though. Obed, correct. Few correct. Okay. All right. That is fine. So we are going to end this, okay? Okay, so the answer is actually C. So usually a block in the left coronary artery should either give you an anterior wall MI or a lateral wall MI. But this patient has what? A left dominant heart, meaning that the PDA, which supplies the inferior wall of the myocardium, actually came from the left. So if you block it, you would get an inferior wall MI as well. Although in 80% of us who have a right dominant heart, the inferior wall is supplied by the RC. Is that okay?